Music that's safe for little ears to hear.
Never inappropriate lyrics or discussion.
Inspiration!
Always family friendly.
A very warm welcome to Health Break. This is where we get to talk health, just to keep you very much health conscious. Thank you so much for staying right here with us. My name is Ima Dem. Okay, on the program this morning, we are looking at a very important topic, and I have resource persons already in the studio to do justice to what we'll be talking about this morning. I have persons from Heartland Alliance who will be talking about HIV interventions, addressing the challenges, and introducing Dr. Ngozi Noel-Ogamba. She's a senior manager, state team lead. That's Akwa Ibom team lead, Heartland Alliance, Nigeria. It's a pleasure to have you in the studio this morning. Welcome to the program.
Thank you.
And I also have Dr. Anefiok Awa. I'm just trying as much as possible to ensure that I don't murder the second name. So Dr. Anefiok Awa is also here in the studio. He's a lead clinician for Heartland Alliance, Nigeria, Akwa Ibom State.
Pleasure is all mine.
When we talk about HIV interventions, some persons will know Heartland Alliance because you've been in Akwa Ibom. How many years?
Yeah, we've been here for more than 10 years.
Okay, so more than 10 years in Akwa Ibom. Heartland Alliance is an indigenous non-governmental organization founded to address the human rights needs of vulnerable persons in the society. A USAID-funded program on accelerating control of HIV epidemic in Nigeria. What more?
Okay, so like you rightly mentioned, Heartland Alliance is an indigenous non-governmental organization, and we've been working in Nigeria, and currently we're implementing our program in 6 states. That's the KPK 1 project we're implementing. We're working in Akwa Ibom, Lagos, Cross River, Bayelsa,
okay, so you just did a very fast one. The
State,
KPK,
yeah,
what does it mean?
Yeah, okay, so that's our intervention that has to do with vulnerable population. We're also implementing another project on AIDS, which we just won, and that's also running, but not in Akwa Ibom State anyway. We're implementing that in Edo State, Lagos, and Bayelsa. So for us in Akwa Ibom, we pride ourselves because we provide comprehensive healthcare services in the state, and because of the kind of work we do, we currently have over 22,000 persons who are on ART treatment with us in our 4 centers in Akwa Ibom. Yeah, 22,000. And ART, that's antiretroviral treatment therapy. So we have over 22,000 of them that are already on treatment with us in the 4 centers we have in Akwa Ibom. In Akwa Ibom State, we have our one-stop shop. We have one in Uyo here. We have one in Eket. We have one in Oron. And then we have one in Ikotebene. So in all of these centers, and we are not just doing only HIV, we're also providing other healthcare services, talk about cervical cancer screening, talk about sexually transmitted infection screening and treatment. And then we also do other range of services like when you talk about human rights interventions, talk about mental health and psychosocial support, talk about gender-based violence. And like when we started talking, you said, okay, you wanted to know why the commissioning of the SARC Center.
We're going to go
I guess that in the course of the discussion that's going to come up. Yeah. So
all right, fantastic. So a lot of areas where we see you giving a helping hand, helping to correct a number of things. So you have cervical cancer, you mentioned, STIs, you have human rights
interventions,
as well, interventions, and mental health.
Yeah.
That's a whole lot.
Yeah, that's a whole lot, yeah.
And then you also talked about sexual and gender-based violence.
Exactly. And it is also interesting to know that we're not just implementing just for implementing sake. In Akwa Ibom State, out of our 4 centers, 3 are already fully registered as clinic to function in the state. And that's with the support of the State Ministry of Health, which is being headed by the Commissioner of Health, Professor Augustine Omo. So we were assessed, and because they found us worthy because of the kind of work we do and the fact that we have all our machines and all our equipment in place, and then that's why we're registered to function as clinic in the States.
Okay, so what caught my attention was, sexual and gender-based violence, and recently it was in the news where the wife of the governor, the first lady of Akwa Ibom State, did commission the referral centers for SGBV, for gender-based violence. Okay. And so I got thinking, I know Heartland Alliance as an organization that is mainly intervening in HIV prevention. So what's the correlation between that and sexual and gender-based violence?
Okay, so I'm just going to briefly talk about that and then allow my colleague to come in. So, yeah, like you rightly said, because of the kind of work we do, HIV and gender-based violence have correlation. Yeah, there's a relationship between these two. And a few weeks ago, as an organization, we actually paid a courtesy call to the wife of the governor, Her Excellency Dr. Mrs. Martha Udom Emmanuel. So, and while we were there, we made a presentation to her on what we're doing on gender-based violence and the intervention we have done in the state. And that caught her interest. And one of our prayer to her was that we want, because of the kind of interventions we render on GBV, we pleaded that we wanted to be commissioned as SARC. So, and that's because we've been working very closely with the State Gender-Based Violence Committee, where she is the chairman. The person who is the executive secretary of that committee, that's Barrister Memete, is somebody who can call Heartland Alliance even in the middle of the night to say, oh, I have a rape case, what do we do? This person needs to be on PEP. And immediately she calls. Of course, she's somebody that once I see her.
So you're bringing up a lot of acronyms. So you say PEP. So a lot of persons don't know.
Sorry. So that's
exposure prophylaxis.
Exactly. That's
right?
Post-exposure prophylaxis. Yeah.
And it's used for.
It means that once somebody has been raped, it means that this person needs to access PEP within 72 hours.
A medication.
Exactly. It's a medication that can make this person not to be infected with HIV in case the person who has raped this person is infected with HIV. So, and aside that, in our center, we don't just end up with providing only that PEP. We also make sure that we provide other services, like when you said mental health, a whole lot. Yeah, because somebody who has been raped is actually traumatized. So this person needs help. All-round help, not just the medical aspect of it, but an all-round help is required for this person. So the wife of the governor deemed it fit that if Heartland Alliance is this responsive and they can always assist the state in what they are doing on gender-based violence, that means we can actually have them commissioned to serve as SARC center in the state. And that's because of where we are located in the state. So it's always easy for people to come in, especially the poor and vulnerable. Our centers are always open for this kind of audience to always walk in to access these services.
I'd like to go to Dr. Anefio Awa. Looking at this correlation that we've just established, SGBV, HIV cases or infections, what's most disturbing is that there is that emphasis, SGBV is driving HIV infections. Can you talk about that?
Thank you very much. When we say SGBV, we mean sexual gender-based violence. So like we know, when a person is forced to have sex, or when sex is forced, it predisposes the person to a monthly of infection, notable HIV, and of course other sexually transmitted infection. So that's one. Forced sex will predispose it to HIV. And then sexual gender-based violence or gender-based violence sexual has direct link with HIV. One is like what I've just established. When sex is forced, of course it predisposes the person to HIV. And then there are other practices like female genital mutilation, which is also gender-based violence sexual. And then we also have other traditional practices, like some persons feel that if they begin to have sex with very little children who are said to be virgins, that it will cure some ailments. It will make them spiritually cleansed.
The myths and misconceptions.
Yes, and so on. So all of these can predispose the victim to HIV. And then I also want to talk a little about other forms of gender-based violence, like the emotional and physical, and how they can also drive the epidemic of HIV. Now, let me give an instance. When a female partner who is HIV positive now has a partner that is not supportive, that abuses her emotionally or maybe physically.
So in this case, possibly the partner is negative.
Probably it's a discordant couple situation where the other partner is negative and then doesn't support this positive partner to take her medications as she should. It's commonplace that this partner can get depressed, can get emotionally down, can get forlorn, and will not continue on our medication. The stigmatization, yes, will make her not to be. And
we know how very important adhering to the medication is.
And that would be a very big problem. So it could be a two-way thing. HIV could worsen gender-based violence. Okay. Gender-based violence could also worsen HIV. So it's never a good situation. So that's why, as an organization, Heartland Alliance is doing everything within its power to combat gender-based violence in totality, especially gender-based violence sexual. So that's why we have our SARC center. Like we're trying to establish, we have a full-fledged system. We have a gender-based focal person who is a psychologist. We have a legal officer who is also the human rights officer. I like to call him the barrister with the PhD because he has a PhD. And then we have a full-fledged clinic where you have qualified medical doctors, pharmacists, medical lab scientists, nurses. And then you have a mental health and psychosocial support provider who is also trained.
So in all these centers, we have this person you just mentioned.
Yes. So that's the point. So when we provide this holistic, comprehensive bouquet of services, we are very sure of excellence.
Okay, I'm speaking with Dr. Ngozi Noel-Ogamba. She's a senior manager, state team lead, Heartland Alliance, Nigeria, Akwa Ibom, and Dr. Nefiok, our lead clinician with Heartland Alliance, Nigeria, Akwa Ibom as well. You can be part of the program. Keep your messages coming through. 0906 030 8705 is a number to send your WhatsApp messages to, and also we'll open the phone lines as well. Keep your calls coming through. 0818 222 9105 0905 995 1059 are the numbers to call. When it's time to take the calls, we'll take that call. 0905 995 1059 0818 222 9105. Okay, going back to you, Dr. Ngozi. So you just established that you have a team in the centers, and the question that will come to mind is, how do people access care there? How do they access help in these centers? What happens? Because now it's a referral center.
Yeah, it's called a referral center because, like I said, this is something that the wife of the governor herself is very passionate about, and that's why, and with the support of the State Ministry of Health and then other agencies that are collaborating with us, like when you talk about FIDA, talk about police, talk about NAPTIP, and then all the others, because they understand the level of service.
Okay, let's just quickly take this call. Hello, good morning. Can you hear me?
Yeah, good morning. I'm hearing you.
Okay, what's your name? Where are you calling from?
Yeah, my name is Nefiok, calling from Ikote. All
right, Nefiok.
Yes, I want to ask the doctors there. Since in your center, since you said that you have a clinic, can't men attend the clinic too for any sickness in their body, or like HIV, where does it situated in the Ikote area?
Okay, just listen, she will respond to. You just heard what he said. It just seems like we're saying it's mainly for women, but that's not the case.
Exactly. It's not mainly for women, even though we know that most times when we talk about gender, it looks like we're talking about only women. But gender is not just about women. We talk about male and female, and that's why we keep using the word vulnerable population. So when we talk about vulnerable population, anybody can be vulnerable. A man can be vulnerable. A woman can be vulnerable. So for you to assess the success...
Hello, good morning.
Good morning.
Yes, good
What's
morning.
your name?
Yeah, this is Joseph Daniel. I'm calling from Shelter Africa.
All right, Joseph.
Yes, I'm listening to what the guests in the studio have said. It's very interesting. But my own analysis of all of this is that all these measures, they are basically reactive in nature, not proactive. Is there no way Action Alliance, in conjunction with the state governments, that committee on gender-based violence, can they go around schools to teach our young girls and boys at the secondary school level?
So you also want to know if they have interventions, that are proactive.
Can they have teach them self-defense skills? So that if a rapist comes around, they can teach them how to defend themselves, self-defense. Those days we are young, we used to have kung fu. They can teach this act of self-defense as initial measure to prevent this gender-based violence. So that when somebody comes, the child or the young adults can be able to defend themselves, except when they are overwhelmed. But if they are taught the act of self-defense, at least at the basic level, I think civil defense corps, they can handle that. Teach them the act of self-defense, they can protect themselves. Thank you.
All right, thank you so much for calling. Finish up with the last response. You were talking about, like you've established, you said when it comes to gender, obviously we're talking about male and female. So you were going ahead, Dr. Ngozi, to talk about, that referral center in Ikote. He wants to know where it is.
Oh, okay. So can we take that towards the end? I need to get the specific. As I said, towards the end, so that we can read out all of the addresses together. One in Ikote, Uyu, Eket, and Oron. We should be able to list all of that together. So I was going to answer the question you asked about how do people have access into this referral center. So it's simple, just like the way we are talking about. On the day of the commissioning, the news was everywhere. Even the state gender-based violence committee also have been going around educating and sensitizing people about, there's a SARC center now in Uyo, outside the one we have in Eket. The state already had commissioned one in Eket, and that one has been up and running since. And then apart from the one that Heartland Alliance also have in Eket there, which is more like it's two now. And then in Uyo, Heartland Alliance premises is open for everybody. We don't discriminate. We don't chase people away, and it's free of charge. So whenever you come into the center, you will meet with the psychologist. From there, they will assess you, hear your story, and then from there, you meet with the gender focal person. From there, you go to the clinic where you're being assessed. The doctor is there, the pharmacy is there, the nurse is there, the lab is there. All the all-round services that we need to provide, we make sure that we provide all of that free of charge.
Okay, so this caller talked about proactiveness. He says what he can see is that this is more of a reactive solution to the problem we are having at hand. So what's the proactive steps that your organization takes to ensure that we continue to nip SGBV in the bud as well as HIV?
Yeah, thank you very much. I appreciate the caller's respect or understanding for prevention. Okay, like they say, prevention is therapeutic, is cure. When you can prevent something, you've gone over 90% at solving that problem. And presently today, preventive care or preventive medicine is heavily being invested by global partners. So what we do in Heartland Alliance with regard preventing gender-based violence is that we pay very close attention to our messaging, preventive messaging. There is a package we have which is known as gender norms. So what this is targeted at achieving is to go to communities, interact with these vulnerable persons, orphans, women, children, men included, and explain to them their basic gender rights and what they can do to prevent this scourge of sexual assault or rape. So there's a vibrant program in place where resources in terms of money, in terms of human power, in terms of other logistics are heavily invested in our communities to drive this message. And the fascinating thing here is that the essence is it is client-based. Like we tailor our messaging to suit the particular needs of clients. So we have to go diverse. We give this message in vernacular, in local dialects, so that there will be no excuse.
There is that reaching out to the community.
Yes, we go to
different communities with these messages. Okay.
And then we also take advantage of social media, Instagram, Twitter, WhatsApp, to also disseminate this messaging on gender norms. So it's a whole package.
Okay, keep the calls coming in. 0818-222-9105 is the number to call in with. The other line 0905-995-1059. Join the conversation this morning. We're talking HIV prevention and also sexual and gender-based violence, particularly how both are correlated. SGBV can drive HIV infections, and this is what Heartland Alliance Nigeria, Akwa Ibom State, is trying as much as possible to nip it the bud, and talking about the referral centers that have been provided by the organization to ensure that the interventions are sustainable. Keep the calls coming in, and your messages you can send to the WhatsApp number 0906-030-8705 as well. Okay, let's just go again to talk about, you've talked so much about the makeup of the center. What are the real life cases that you've seen? Can you share some of that with us?
Heartbreaking. So at the center, even before we were commissioned, of course we had testimonies, we had scenarios, we had cases, real life, real time cases, even before we were formally commissioned. So you can imagine a situation whereby you come to work on daily basis and you have people who are already waiting, sometimes not just one person, sometimes 2, 3, 4 persons. And sometimes they don't just come direct to us, because like I've talked about, the people we are collaborating with, we're working with FIDA, we're working with the state GBV, we're working with police. So you come in and probably they just bring in somebody to say, oh, this person just got raped. And you begin to look at it, and in most cases, aside the fact that, okay, we may have adults who are also raped, like the recent case that we had, there were 6 in number, but that 6 were actually like 2 scenarios, 4 sets of women who were going to markets, and that's why I want to also use this opportunity.
About 6 rape
victims, survivors, So let me also use this opportunity to also state and plead with our people. Whenever you are traveling, please go to a registered park. Go to a registered motor park to enter a vehicle, so that if anything happens, it could be traceable. So we had cases whereby 4 women who were on their way to about to go buy their wares were actually robbed, because the vehicle they entered, they didn't know they were armed robbers. They were raped, they were robbed, everything they had on them were taken away from them. And okay, in the course of these people, they were referred to the clinic, to the OSS, and when they got there, In the course of us trying to provide services to these women, we found out that one came out reactive. So now this person didn't know that she was already reactive. So you can imagine the person who may have raped this person may have ended up infecting himself. And that's how...
So when you say reactive, this person is
HIV positive. Yeah. So what this means is that, okay, this person now who has raped this person will now go around infecting other people, probably without even knowing. Okay, now we had the other two that made them complete 6. These people were in their home. 2 young girls who were in their home, and somebody just broke into their home. 7 hefty guys broke into their home at about 1:30 a.m. All of this happening in Akwa Ibom State. I won't mention specific locations because of confidentiality sake. So you can imagine that morning coming into the center and you have 6 rape cases waiting for you to be attended to. Okay, like I said, this may even be about young people. What about cases about infants? It is very, very rampant in Akwa Ibom State, and I don't know why.
Well, that one.
We see a lot of that. We had a case of a 6-year-old girl who was constantly molested, because when we open them up, you're not just seeing a one-off rape. You're seeing that this person is set exactly over time. A 6-year-old girl constantly being raped and has ended up being infected with HIV. We had one just 2 weeks ago. A child of just 1 year and 6 months.
Barely 2 years.
Barely 2 years. And this person have constantly abused this child. And now this child is HIV positive, and this child has warts, inner warts. So you can imagine, what is it about 1 year and 6 months old girl? Okay, we had another incident that the police brought to us. A 7-year-old girl. Police brought her because the father of the child went to report. Okay, now the father of this child is even scared. They know who the perpetrator is because they are poor. According to the father, they are living in these people's compound. The mother of this 16-year-old boy knows, the father knows that this 16-year-old boy is constantly abusing this 7-year-old girl. But the father of the child, he only summoned courage to come and report to the police station. Now, police brought the child to our center, and the clinician had to look at the child, and we had to provide all the services that we need to provide. But we need to get who this culprit is. And that's where the challenge is. Because sometimes even when they come forward to make this report, they wouldn't take you to the perpetrator. One of the cases that we had in one of the LGAs, it was a case of they said, oh, we don't want to see Heartland Alliance here again. How come you bring in police to come and arrest our people and all of that? It means the community is actually trying to shield the perpetrator. So, and at the end of the day, you now begin to ask, what is the hope that if rape victims or rape survivors report their cases, that they will get help?
Okay, so we have a lot to talk about. Definitely, we cannot exhaust that in just 30 minutes. That's, of course, the span of this program. It means it cannot be a one-off conversation.
Exactly.
We look forward to having you again to talk more on this and even the other interventions that I know that you bring on board as well. But then I'd just like to go to Dr. Nefyok Awa at this point to really ask, how do you encourage survivors to come up, or victims, to come up? Because I know the importance of someone is raped and the person reports immediately. There is hope, and possibly the person can be placed on PEP, like you mentioned, the post-exposure prophylaxis.
Yeah.
Thank you very much. Like I said earlier, we do a lot of work in preventive care. We leverage on our messaging power, our ability to reach communities in languages that they understand, using anecdotes that they can identify with to make them come out when there are cases like that. So this program will also be one avenue to reach out to them. So I want to say, if there are any cases of sexual assault, please feel free to come. It's a referral center, but there's also room for self-referral.
I want to ask the question because there's emphasis on referral, but then someone can just walk in as well.
Yes, exactly. that's the referral system is two-pronged: self-referral and referral from our partners and stakeholders, like the police, because we get a lot of referrals from people. And I also want to emphasize that victims of sexual abuse should report to the police station. Please, should report to the police station, and then the police will make the necessary referral.
At this point, we do not have much time, just about 2 minutes to the bottom of the hour. So I'd just like to come to you to tell us where the centers are, and like you said, it's very accessible.
Yeah, okay, so when we started, I said we have 4 centers in Akwa Ibom State. Heartland Alliance have 4 one-stop shops in Akwa Ibom State. We have one in Uyo here, and the one in Uyo here is at number 26 Ebel Damina Drive, Osama Drive. Ebadamina Drive, Osoma Estate. That's in Uyo here. And then in Ikotebene, we are at number 76 Ephraim Essien GRE Ikotebene, number 78 Ephraim Essien GRE Ikotebene. And then in Oron, we are at number 1 Martin Effiong Close, beside Amok Temple off Civic Center Road, Oron. I'll take that again. At Oron OSS, we are at number 1 Martin Effiong Close, beside Amok Temple off Civic Road Center, Oron. And in all of these places, we have billboards and we have signboards that will actually tell you that this is where you are. And then for the one in Eket, we are at number 6 Insect Took off SDP Road, opposite road safety. That's the one in Eket. Number 6 Insect Took off SDP Road, opposite road safety in Eket. So in any of these centers that you work in, and the good thing is that we also provide what we call 24-hour services.
Oh,
so
really?
it means
Okay.
that at any point in time you're walking into any of these 4 centers, you have somebody there who must attend to you. So please, people should feel free to come in and access help, and also make sure that they adhere to whatever medications or whatever help they get from those centers.
The services
Thank
are-
Okay.
you.
I can't take much more, but then
Services are
definitely we'll get to talk to you in the days ahead. I just want to mention to our listeners that you can send messages. You have questions, do send them to our Twitter handle at IFM1059, and also our Facebook page, facebook.com/IFM1059. Questions for the organization, definitely they will attend to you. You can reach out to them via this particular handles, facebook.com/IFM1059 and at IFM1059, the Twitter handle. Thank you so much, Dr. Ngozi Noel-Ogamba and Dr. Inefiok Awa, obviously from Heartland Alliance, Nigeria, Akwa Ibom. It was a pleasure having you on the program.
Thank you so much. Thank you.
My
Thank
name
you,
is
Ima Dem. Thank
Ima
you, Inspiration FM.
Dem.
Yeah.
The program returns next week. To stay health conscious.
Inspiration FM is inspiration.